Hello, and welcome back to Virtual Learning with Miss M. This week, we are going to focus on the alternative methods to treating cancer. This is what we called complementary alternative medicine, otherwise known as CAM. We know that cancer is traditionally treated with chemotherapy, radiation, and sometimes surgery. Due to research, there is some benefits to complementary alternative medicine as a treatment of cancer. This can include treatments such as biofeedback, acupuncture, massage, and herbal medicines. This week, we will focus on the complementary alternative medicine of biofeedback. Biofeedback is a way to help you learn to better control your body and respond to stress. So, how does this happen? A biofeedback therapist places electrodes on your skin to measure heart rate, blood pressure, and muscle tension. Sometimes electrodes are placed on your head to monitor brain waves. This information is sent to computers that then gives us feedback about bodily functions. Why is this a great form of complementary alternative medicine? Well, biofeedback therapy helps you become better aware of your physiological response to certain stressors. Biofeedback therapy can help you develop better relaxation techniques as a method of handling specific symptoms due to cancer, such as nausea, fatigue, headaches, just to name a few. Some methods of biofeedback are used to counteract symptoms due to cancer. These methods include deep breathing, guided imagery, mindfulness meditation, progressive muscle relaxation, and self-hypnosis. All the techniques mentioned are used to help slow breathing, lower heart rate and blood pressure, and gives you a better sense of well-being. Have you ever heard of chemo brain? Chemo brain is associated to many people who experience chemo symptoms well after chemotherapy has ended. People who experience chemo brain can experience trouble sleeping, fatigue, and other physiological issues. Patients with chemo brain who use biofeedback as a form of therapy have experienced an improvement in these symptoms. Now, let's watch Mags Bolowski describe chemo brain and her experiences with chemo brain. I just said the same thing over.
What? I don't know. This never used to be this hard. Did cancer make me dumber? Hello everyone, in today's video I wanted to address a problem that many of us cancer patients and cancer survivors have to face. Along with the added problems of cancer and treatments, we also get to experience this lovely side effect called chemo brain, or also known as chemo fog. So what is chemo brain? Well, I like to think of it as like a glitch in the system, like when you're knocking and it's not that no one's home, but someone that's very confused is home. So I guess that's the easiest way to explain it, but what chemo brain is memory and thinking problems that occur during and after cancer treatment. And although chemo brain is temporary and it does go away sometime after treatment, there are rare chances that it can become permanent. So here's a little bit more about what chemo brain is. The duration and severity of chemo fog does vary from person to person, and there are many different symptoms such as disorientation, confusion, difficulty concentrating, finding the right words, multitasking, or even learning something new, short-term memory problems, trouble remembering conversations and images, taking longer to finish tasks, difficulty keeping the flow of conversation, and many others. So for me, oh, here it goes, embarrassing. So for me, my chemo brain is, I forget how to English. So I'll be talking, and then all of a sudden, like I can't get my words out. It's really weird and it's very frustrating. And sometimes it takes me like 3 to 4 tries to actually be able to say the word. So yeah, I basically just forget how to English sometimes. Usually when I'm filming and it happens, which it does kind of frequently, I will edit it out and refilm it. But for the purpose of this video, if it does happen, I will leave it in just so you can see. I think I've had like blurbs of it in my other videos just because it's funny sometimes, and I do laugh it off most of the time. But it is quite frustrating when you're trying to talk to someone and you right. So, a friend of mine, her chemo brain was that she thought she'd said something out loud, but she never actually did. So she would try to ask someone to do something for her, and in her brain, she said it out loud, but she never actually said it. And she found that very frustrating because then the person's like, well, no, you never said anything to me. So yeah, that's another form of chemo brain. So as you can see, like, these symptoms are not the same for everyone. They vary from person to person. Everyone's brain glitches differently, I guess. So what causes chemo brain? Well, the term chemo brain is actually misleading because it's much more than just chemotherapy treatment that can cause this mental fogginess. Any sort of medication or cancer-related treatments can also cause a little glitch in your system, as well as simply just the stress and anxiety of being diagnosed or having this illness. So how can you help or treat chemo brain? Well, unfortunately, there's no known medication that can completely help eliminate all of the symptoms and side effects of chemo fog. However, there are a few little exercises that you can do to help your brain out. First thing is to slow down and take your time. If you can't multitask, that's okay. So slow down and focus on what you're doing and you'll get it done. Next thing is to exercise your brain. So you can do that by doing puzzles, crossword puzzles, Sudoku, just reading, anything that really kind of gets your brain functioning. You can try to learn something new, learn a new language, anything that'll just basically, get your mind going. Relax and minimize distractions. So if you find that it's really hard for you to concentrate and focus, try to relax and go in a quiet room somewhere where there's minimal distractions that will allow you to get what you want done. Use your tools. So for me, before I got sick, I used to be one of those people that kept everything up here, and honestly, it worked really well for me. I loved it. I always remembered everything, but when I got sick, that left me. That blessing left me. So now I have to use my tools, so thank goodness for these guys right over here. I use the reminders app on my phone all the time to remind me of different things I have to get done, of different places I have to be, appointments I have, and then I am still old school and love to write things down. So for more important things like doctor's appointments, meetings, even honestly outings with friends, because I forget about those sometimes too, I will write them down in my planner and make sure that I look at my planner every single day. Next is ask for help. I know it can be super embarrassing when you're feeling very forgetful or you can't get the most basic task done, but people do want to help you. So if you need it, please ask for help. Next is take someone with you to important appointments, whether that be a family member, a friend, or a significant other. Ask them to come with you to important things so they can either write stuff down for you or just be a second set of ears to listen. Lastly, if your symptoms are really bad and it's really getting in the way of you being able to live your life, write them down, write down what time they happened and what kind of symptoms you're having, and then go talk to your doctor. Your doctor might be able to refer you to a specialist who may be able to help you out in different ways. And just remember that this is temporarily and see? And just remember that this is temporary and in most cases it will go away after treatment. So just hang in there. And I just really quickly wanted to add, for those of you who know a cancer survivor or a cancer patient and are their caregiver or friend, ways that you can help someone who is experiencing difficulties like this is just to really be patient. They are probably very embarrassed and very frustrated, so be patient with them. If you notice that they're, if you knew them beforehand and you notice that they're slower or tasks are harder for them to accomplish or they stutter on their words and they can't remember, try to help them out and just be patient with them. And lastly, offer to help. So go to appointments with them, offer to maybe schedule stuff for them or write stuff down for them. Just be that second set of eyes and ears to help them out through this difficult time. Having someone there who will help you out really does make a huge difference. That's all for today's video. I hope that I did help inform and shed some light on what chemo brain and chemo fog is. If you like informative videos like this with the kind of tidbits of facts, I guess, of what cancer patients are going through, please hit the like button and subscribe to my channel. If you have any questions or comments about chemo brain and chemo fog, please leave them down in the comments below. And you know what I'm about to say. You know it's important. Know yourself and know your body. Until next time.
Let's take a look at biofeedback in action. In the following clip, you'll see how biofeedback is used to help with bowel movements in children. Now, those suffering from colorectal cancer can sometimes get part of the bowels removed, which then causes incontinence or loose bowels. Biofeedback therapy can assist with these side effects of surgery. Now, let's take a look at biofeedback in action.
Hi, my name is Carrie Dowds. I'm one of the nurses in the Susie and Scott Lustgarten Center for GI Motility at the Children's Hospital of Philadelphia. This is an information video for parents and caregivers. At the end of this video, if you feel it is appropriate for your child to watch, we suggest that you sit down with your child and view it together. Even though everyone has bowel movements, it's not always easy. Our bodies make stool all the time, and our stomach and bottom muscles need to work together to get the stool out. Sometimes these muscles get out of sync. Biofeedback is a fun and non-invasive way to help your child see how their muscles are working together. With practice, your child can learn to get the muscles coordinated again. Now let's see this in action. Hi Kieran, how are you?
Good.
Good. My name is Carrie. I'm one of the nurses in the endoscopy suite. I'm here to teach you about biofeedback. These sessions take about 10 to 15 minutes and will occur weekly to every other week. During the first session, a nurse will explain to you and your child about the equipment and how it works, what muscles are used when trying to have a bowel movement, and the proper sitting technique when having a bowel movement. They will also ask about your child's toileting and stooling patterns at home. Okay? So you know everyone has to poop, right? But sometimes it's hard to poop because you have to use the right muscles. You have to use your belly muscles and your bottom muscles. So this is a special game that we use to see what muscles we are using when we're trying to poop. All it entails are 6 really small stickers. Nothing is going inside of you. We have 3 stickers that are going to go on your belly. 2 stickers are going to go on your bottom. Nothing is inside. It's just going to go right kind of next to where the poop comes out. And then the last sticker is going to go on your leg. And these stickers are connected to this machine. And as you're pushing, as if you're trying to poop, you're going to look up here and you're going to see a fish and bubbles. And you're going to try to get the fish to eat the bubbles. Do you have any questions? Okay. Your child will sit on a special chair called a commode, and we will ask them to bear down as if they are having a bowel movement. As your child does this, they will be looking at a computer screen. The act of pushing or squeezing will cause an object on the screen to move. So you see this fish? This fish is controlled by your belly. So what I want you to do is the next time these pink bubbles come around, I want you to push like you're trying to poop. Okay, so during this period you're resting, and then as soon as you see these pink bubbles, as soon as your fish gets right up to it, I want you to push. Okay, ready? And push. Push, 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 push. Keep pushing. These visual and auditory cues will help your child learn which muscles they are using to have a bowel movement. During subsequent sessions, the nurse will reinforce this education and provide encouragement to your child. As the sessions continue, the nurse will begin to take away the visual and auditory cues to mimic the home setting. They will also continue to evaluate your child's progress at home. Thank you so much for watching this video. If you have any more questions, please contact your physician. Your child's care is our top priority.
Thank you for joining me this week as we learn about biofeedback therapy as a form of alternative medicine in regards to treating cancer. Until next week, guys. Bye!